Hello and welcome to Inside Cottonwood. I'm your host and City Manager, Doug Bartosh. And we're here today to talk to Dr. Catalico, affectionately known as Dr. C. And he is a retired family practitioner who is now on the board of MATForce. And for those of you who don't know about MATForce, MATForce was begun in 2006 in response to the methamphetamine problem we were experiencing in Yavapai County. It was very successful. We were able to reduce the use of that substantially by education, prevention, through law enforcement, through the treatment community, and it was really very effective. And we've gone on from there because if history tells us anything, it seems like every time there's a drug that's a fad, there's as that kind of goes out of use and out of the fad, there's something else that crops up right behind it. And so we've worked on a variety of substance abuse issues, both with young people and with older people and adults. And today we're here to talk about the problem with prescription drug abuse. And this was an issue that spoke pretty deeply to Dr. C because, one, he is a physician. He's a prescriber of prescription medications, but he was also a pharmacist in his prior life, and
that's right.
And so he's well versed on this topic. But Dr. C has done great work on this throughout the state. We've really become a leader in terms of dealing with the problem of prescription drug abuse. So, Dr. C.
Yeah.
First off, I guess I know, I think it was Richard Daynard that actually brought you to one of our meetings and got you involved, as I recall.
Yes, that's exactly right. He gave me a phone call and told me that MATForce was going to turn its attention to the prescription drug abuse problem that exists not only in Arizona but across the country, and that got me interested. And I went to my first meeting on a Wednesday at the safety building. Sat there quietly taking in all the things that were going on, and from that point on I haven't been quiet. I took it as a challenge for me to go out and try to contact pharmacists, contact physicians, and try to solve some of the problems that exist.
You know, and I know one of the meetings we had, there was parents that came in and talked about their daughter who had knee surgery.
That's correct.
And I know that moved me. I'm sure that moved you as well. But you know, she wasn't a person with a history of drinking or substance abuse or anything, but she got hooked on prescription drugs to the point of actually losing her life from an overdose. And so in your career, in your practice, I'm sure you saw some of this. And,
sure, I saw the damage that these types of problems cause, not only to the individual patient themselves, but also to the families and friends of the people that get involved with this. And that particular young lady, after that meeting that day, I said to Marilee Fowler, the director of MATForce, that I never want to have to come to another meeting to listen to a set of parents describe the horror that they had to go through with the death of that lovely young lady. So we've been pretty lucky. Since that time, we've been able to reduce deaths from prescription drugs with some of the work that we've done.
And let's talk, because a lot of people in the audience probably don't understand the prescription drugs we're talking about. What are the ones that are causing the concern?
Well, what they're called are controlled substances, and mainly the drugs that we're talking about are drugs that are derived originally from opium, and they're called opioids, narcotics. But there are also other controlled substances like the class of drugs called benzodiazepines, which are used for anxiety. Certain muscle relaxants are included in this too, because a combination of those narcotics, of benzodiazepines such as Xanax or Ativan, the narcotics we're talking about are oxycodone, Vicodin, OxyContin, etc., even morphine. And if you combine those with muscle relaxants similar to Soma or Flexeril, those three drugs all have a deleterious effect on depressing respiration or breathing. So the combination of those three, and in some cases they even combine alcohol with it, and it is a very potent combination that can cause death. So that's what we're trying to do, is cut down the amount of these drugs prescribed by educating physicians to use other means of controlling pain, such as acupuncture, yoga, weight reduction, manipulation, either osteopathic or chiropractic, exercise programs, anything that would afford the patient some relief. In addition, other classes of medications such as the antidepressants are also useful in relieving pain. So we're trying to educate prescribers, A, to use alternative methods of treatment, so to speak, and B, when they prescribe a medicine for a patient, be conscious of the fact that the amount of medication that you write for and is dispensed by the pharmacy may come into play, in a sense that if you write for 50 pills and the patient only uses 2 to 6, that the rest of those pills lay around in the medicine cabinet and can be subjected to use by teenagers in the family, other members of the family who scoot through and look for these things. And once they get into general use, they can start the progression from opioids or painkillers or narcotics down eventually to heroin.
And, you know, I know we kind of, MATForce, when I say we, started off on trying to educate people throughout the county, trying to develop a program. And I guess to our benefit, and I think the benefit of the state, the Arizona Criminal Justice Commission became a part of that effort. Talk a little bit about how they partnered with us and what developed from that partnership.
Well, we were involved with prescription drug abuse problems since 2011. When I made my first visit in April of 2011, from that point on we knew we had a job to do and we were going to do it. We were visited by a young lady named Shana Malone in about the 3rd or 4th month that I was with MATForce, and she was from the Arizona Criminal Justice Commission. She had stated that the governor was looking into starting a so-called initiative to reduce prescription drug abuse and misuse, and that would occur most probably in the year 2012. Well, when it was ready to start, Yavapai County was selected as one of 3 pilot counties to get involved in this initiative because of all the work that we had done pre the start of the initiative. We were way ahead of everybody else. The initiative itself was a package of about 25 stipulations and things that you had to do and accomplish to show that these things would be statistically important in helping to reduce the substance abuse problem. So once we started on that, and that officially started in June of 2012, and as I say, we were ahead of the system, we had completed the initiative way before the end point of June of 2013, very successfully. And what they wanted to do was have the 3 pilot counties accomplish the goal of trying to reduce substance abuse, and then use the programs that they initiated, come up with a so-called toolkit, which they could then print and publish and give to the rest of the counties to follow our lead step by step so that they would have the same success that we did. And when I say success, we were successful in, for instance, having the 2 major hospitals in Yavapai County, Yavapai Regional Medical Center in Prescott with 3 campuses, and the Verde Valley Medical Center in Cottonwood with a major presence here, adopt some changes in their emergency room protocols, which called for less narcotic use in the emergency room itself and less prescribing by the doctors there of numbers of pills given to patients when they leave the emergency room. For instance, you would no longer be able to go and say that your pain medicine was out and that you needed a new refill and get 100 pills. Right now, the limit is 20. And if you go with an acute problem, they will give you 20 pills and refer you back to your attending physician, whoever that might be, your family physician, orthopedist, or whatever. So that has done 2 things. It's made a work environment safer in both hospitals. It's improved patient care, and indeed, through use of the prescription drug monitoring site that we've been pushing by the hospitals, in the emergency room department, they're referring more patients now that they've encountered who need treatment for a substance abuse problem, which was evident by the reports that were coming out of the state board site.
Let's go ahead and take our first break, and then I want to come back and talk a little bit more about the prescription drug monitoring program.
Yes, sir.
I think that was a big piece of it. So come back and join us.
I'm a teacher. Let me tell you what I make. I make learning a privilege, not a chore, and frustration a tool, not an obstacle. I make working hard seem easy and giving up impossible. I make an old subject feel like a fresh thought and unconventional methods common. I'm a teacher. I make more.
Welcome back to Inside Cottonwood. I'm your host, Doug Bartosh, here with Dr. Cottonwood, talking about prescription drug abuse. And before we left, we began to talk a little bit about, it's a state program called the Prescription Drug Monitoring Program. Talk about that, because I know you played a big role in getting people to use that.
Well, the Prescription Drug Monitoring Program was started in 2008 by the Arizona State Board of Pharmacy. And what it is an internet site that they monitor where a physician or pharmacist, and in some cases law enforcement, can look up a patient's history with regards to use of controlled substances, anything from the narcotics to the benzodiazepines to the muscle relaxants. And the reason it's important is that it allows a physician to look up a patient's history with regard to the use of these medications, not only from the standpoint of helping to reduce what's called doctor shopping, going from one doctor to another, but to be sure that when you prescribe a substance, that another physician may be prescribing a substance which, combined with what you're using, would have a very bad effect on the patient. In addition to which, sometimes when you use the site, you may discover that a patient is, as I said, using many physicians and many pharmacies. And when you confront the patient at times with this information and say that it looks to me like you may have a problem with prescription drugs, oftentimes the patient will say, yes, I do. Thank you for saying that, and I need some help. So it's been a way for us to not only identify people who are doing something wrong, but also identify people who have a problem and need some help. Now, our state has this site up. 49 of the 50 states have it right now. Eventually, they will all be linked by the federal government, because the federal government is in much favor of having this done. 5 states, including Kentucky, New York, Tennessee, Ohio, and Tennessee, now have a law that says use of this site is mandated by the state, to the extent that before a doctor or a prescriber of any sort can write a prescription for a narcotic for a patient, they must get a report from the state and then base what they're going to do on that report. In our state right now, currently, as in other states, it's a voluntary type of thing. And we've been trying desperately to get more and more physicians, nurse practitioners, dentists, etc., to use this site, because we know it's a safety factor for the patient. It's also a safety factor for the prescriber, in that there's a malpractice problem that can occur if you don't know what a patient is taking and prescribe something in addition to it. Unfortunately, right now, only 31.4% of prescribers in Arizona are registered for and using the site. We desperately need to get that up. We need a bigger percentage of our prescribers to use it to afford everybody the safety that's available.
You know, and I know one of the programs that MATForce put together had to do with, I think, what was the program called? Save a Life or something
Yes,
like
what
that?
we did initially to try and get more doctors to register for and use it was to send out a pamphlet that said, sign up to save lives. About 6 to 8 months later, we did a similar mailing which said, sign up for safety, to illuminate the fact that it's safe for the patient and safe for the physician as well. We're even at this point making personal visits in Yavapai County to the physicians' offices to talk to the office manager about the need to use this site, the reason it's a good idea to use this site, in hopes of getting more of the doctors to realize the fact that they must do this in order to conform to standard of care, which is now in effect from the licensing boards, in a sense that if you're brought before the board for a case of perhaps an unfortunate death or overprescribing perhaps, if they look at your charts, your records, and see that you did not access the site on the internet about the use of the medications, they will actually sanction you in some way. And depending on how bad the situation is, it can go from sanctioning you to removing your license. So it really is something that's vitally necessary from the standpoint of A, patient safety, B, physician safety with regards to malpractice. So to me, it's a no-brainer. It's something that should be done.
And let's talk about some of the other programs that were put in place, because, and it was based on kind of this work plan or model that we worked through, but there were several different areas. If you could just, what were the highlights of that program?
Well, we have in Yavapai County, now I will mention this, that although the state is at around 30 to 31% signed up and using, Yavapai County's percentage is around 42, showing results of the work that we've been doing. We have at different times spoken to the hospital staffs to try and get them to use this site and realize the safety factor of it. Of course, we've had drug take-back programs, and we participated in the federal programs to the tune of removing thousands of pounds of unused or unwanted medication from people's homes.
And explain why. Why is that important?
Well, it's important because if those medications lay around, for instance, in the unfortunate case of a death, there might be actually thousands of pills that have been used over a period of time that are just collected and kept in a box someplace in the house. And if those pills fall into the hands, for instance, of some teenagers or young people, and they take them, then we have problems with overdose, side effects, etc. It's not unusual for teenagers to have a party on the weekend where they have a bowl in the center of the area and they fill it with all different pills that everybody brings, different colors, very attractive. And the game involves, it's called the Skittles game, and the game involves taking a handful of those pills and drinking some vodka with it, and let's just see what happens. Well, they may not be narcotics, and some of those pills can just be plain old blood pressure or heart pills. But if there's something called a beta blocker that's used for heart disease, some facets of heart disease and hypertension, and one of those teenagers or young adults takes those pills and happens to be asthmatic, happens to have an asthmatic attack, by the time they get to the emergency room, the drug epinephrine or adrenaline won't work because they've taken a drug that blocks it. So there's all kinds of facets of problems that occur by taking medications that are not intended for their use.
You know, I know another area that you worked on pretty successfully was with the VA.
Yes, prior to our contacting them, the VA did not participate in having their physicians send information to the site and also having their physicians look up information. And the reason that's important is as a private practice physician, when I would see a vet who would come in and request a refill on his pain medication, for instance, I could not search the database to see what the VA had already given him. And I know for a fact that the DA sends out 3 months supply of medication, including narcotics, to the folks that they're treating. So it became a difficult situation to say no to a veteran that I respected for what he had done for our country, with the fact in knowledge that I couldn't check as to whether he was telling me the truth or not. by using this site. Now, since we started working with the VA and then in contact with Paul Gosar, our representative from this area, through Sheila Polk and Marilee Fowler, it was discovered that there is no prohibition for them not using the site. And within the last month or in the coming month, they will be geared up through their computer programs to start sending information to the site so that anyone can look it up. And by the way, I want to remind everybody that you cannot look up a patient's history on the prescription drug monitoring site unless you are involved in their treatment. And we made it a lot easier now to use this by approaching Senator Kelly Ward, an osteopathic physician from Lake Havasu, who works in an emergency room. And she, after our request, put into the law a statement that allows the doctor's delegate, meaning a medical assistant or a nurse practitioner or a physician's assistant who works with them, to look up the information for them, saving them the time. So hopefully, if this continues and we continue an upswing in the use of this, we'll see less and less of a problem. And again, it presents back to the heroin problem, because if we can stop it before they get to the need for heroin, we'll be successful.
Let's go ahead and take our next break and come back and join us to learn a little bit more. Welcome back to Inside Cottonwood. I'm your host, Doug Bartosh, and we're here with Dr. Cottonwood talking about prescription drug abuse and the MATForce program to try and reduce that abuse. You know, and I think it's important to talk about, because I know it was one of the things that I learned as we got into this, trying to do something about prescription drug abuse, is people don't start using prescription drugs with the intent that they're going to get addicted. I mean, even this young woman we talked about earlier in the program, she was legitimately taking them for a purpose. But what we found was that you build up a tolerance and you end up having to take more and more.
Well, one of the things that I learned, and I've known about it for a while, but it was reiterated at a conference in Phoenix about a month ago. There were a large group of treatment physicians there, and one of them, an addiction specialist from Tucson, stated that if a patient is taking a narcotic medication 90 days, you're addicted. So the point of our exercise is to try to get physicians to understand that and cut them off before they get to the 90 days by using these other manners of treatment. Because after 90 days, it's awfully difficult to get a patient off of the medication. Also, it's been shown that after 6 months, these medicines really are not effective in any way other than psychologically. And the addiction that is caused, in some cases, it causes a euphoria, or the patient actually feels better, you know, and that's why they want to continue using the drugs. So you're right, you're not giving these medicines because they are marvelous medicines. Let's face it, they reduce the amount of pain that a patient has. And the real goal, though, when you're treating pain is to get the patient back to their normal rate of activity, normal activity levels. And that's why you have to use other forms of treatment, physical therapy and things like that, to get them active again.
Now, another program or part of the model that you had a lot of involvement in and a lot of impact was because of your history was our drugstores, the pharmacies.
Yeah, well, you know, originally when I undertook this, I knew that there were three areas we had to cover. Number one, the prescribers, the physicians, nurse practitioners, dentists. We had to re-educate and get these people in line and try to make them understand that this is a national problem as well as a local problem. Secondly, we had to go after the pharmacists because the pharmacists are the final dispensers of these medications, and their job, of course, is to monitor what a patient is taking. It's not just count the pills, put them in a bottle, and hand them over the counter. A monkey can do that. But they have to have knowledge of the use of the medication, knowledge of what the patient is being treated for, the side effects of the medicine, and what can happen if they're taking too much. So in order to do that, we had to go first to district managers for the pharmacists, finally to the Arizona Pharmacists Association, which led to a huge conference with the representatives from all of the major stores, Walgreens, CVS, Walmart, Safeway, etc. So that once we got them on board at that meeting, from that meeting came a complete booklet of guidelines for the pharmacists to follow. Now, when it came to the emergency rooms, we had a conference down in Phoenix where a huge number of emergency room physicians, including ours from Verde Valley Medical Center and Yavapai Regional Medical Center, got together and adopted protocols that were already in use in the state of Washington, changed them somewhat to afford us the necessary manner in which we could put these protocols into effect. And from that, again, came a booklet which the hospitals are supposed to use as guidelines in their emergency rooms. Now, we haven't had success with that yet. I think there's only 5 hospitals in the state that are using those guidelines. But I'm making a move within the next week or so to talk to the Arizona Hospital and Health Association, which is an association of all the hospitals in the state, to try to get them to put forth a move to get the emergency rooms in line. And lastly, a group of guidelines for prescribing for the individual physicians was accomplished in November of 2014. That's been published, and we're trying to get that out. One of the ways is with the conferences that the Osteopathic State Board of Examiners is utilizing to educate their physicians on the proper use of these medications, the problems that you can encounter with these medications, and why it's necessary to use the guidelines as a tool for safety. We've had some pretty good results.
Yeah, after all this work that's gone on over the last couple of years, what are the results?
Well, in the 3 pilot counties, there's been a 28% decrease in deaths from prescription drugs. In the rest of the, I'm sorry, in the 3 pilot counties, there's a 28% decrease in deaths from prescription drugs. Now, the rest of the state combined only showed a 4% increase. Now, in Yavapai County in 2011, there were 11 deaths, and in the year 2013, there were only 4 attributed to overdose of prescription drugs. The Youth Substance Abuse Survey, which is done by the Arizona Criminal Justice Commission, showed in Yavapai County abuse decreased 37% from 2012 to 2014. The state total decreased only 20%. So Yavapai County, again, is ahead in the work that we're doing. And use of the prescription drug monitoring site from the State Board of Pharmacy showed a use increase in Yavapai County from 17% to 41% in 2014. Statewide use of this site is at 31%, as I mentioned before, and we must increase the effectiveness of this tool. So requests for information from the PDMP, by the way, have increased 117% over the number of requests that were made in 2012. So we are seeing some increase.
Effect. And most importantly, we're not losing lives, as many lives as we were. And but generally, they were young lives.
That's true. And one of the things that I have to point out is that, again, in that heroin program that was on TV on Tuesday evening, it was stated that an unintended consequence of what we're doing and the success we're having is the increased use in heroin.
You know, and that's, I know from our law enforcement experts, both in the state and even federally, what they're telling us is both because they know the country is trying to reduce prescription drug abuse, putting in place, the cartels in Mexico saw an opportunity. And so they've been pushing heroin big time. The other thing is, with the legalization of marijuana, the cartels are trying to open up another market. And so we kind of predicted that heroin may be our next problem.
It's true, but what we have to do when you mention marijuana is, if we can, try and prevent legalization of this drug, because they state it's no more dangerous than alcohol. Well, that's like saying a 45 caliber bullet is no more dangerous than a 50 caliber bullet. They're both bullets. Yeah. So if we can prevent the use of one and try to control the use of the other, as we've been, then we'll have success. Now, the drug czar is a fellow named Dr. Michael Botticelli, and I've had the opportunity to meet him personally, both in Washington and in Phoenix, and he has told me personally, do not stop what you're doing in reducing prescription drug abuse and misuse, but try to increase your efforts, because eventually you will have success in reducing the use of heroin and other substances. So that's what we're trying to do, and you have to remember that all aspects of society are involved in the fight. It's physicians, pharmacists, patients, importantly, parents. And education is the key to prevention, and the reason why MATForce is going to continue to be an effective way to eventually win over this scourge of abuse in our great state of Arizona.
You know, and we have to wrap it up here, but again, I'd like to publicly thank Dr. C for his work, because he's just been fantastic on this, and in fact it's being recognized with a statewide, what's the name of the award?
It's a Han Caccino Award given
Award, which
in Phoenix.
Is a real honor for Dr. C and for MATForce, and in fact MATForce was just recognized as the Coalition of the Year for drug prevention nationally. So, you know, from methamphetamine to prescription drugs, MATForce works on underage drinking. Now it's heroin, and it's all about substance abuse and trying to make people's lives better. And it's through these efforts that we hope to save lives and just ensure a quality of life for people. So help us out as much as you can. Thanks, Dr. C, for joining us.
Thank you for having me today. I appreciate it very much.
You betcha. We'll have you back again. Come back and join us on Inside Cottonwood.